particularly when you talk about depression. Depression by year 2030 is expected to account for people who suffer the most in terms of disability. So that is what we are saying, that psychiatry is really, really relevant in the world today. You cannot be well if your mental health is not well.
Hello, hello, hello. You are welcome again to this channel where you get educated, informed, inspired, and we kind of create awareness about things we all need to know as humans living on this earth with blood in our veins. So yes, today we are going to be talking about psychiatry. And when I say psychiatry, that brings up that lights a bulb in your head about mental well-being. So I am very fortunate to be with a friend of mine. She was in Yellow House, I was in Red House. And we come a long way from Fejikola, that was Federal Government Girls College, Akure. And the funny thing about it is we haven't spoken for decades, but we've been on the group chats, chatting and all of that. So it was nice for her to actually accept to do this interview, despite us not having been able to speak for a long time. So anyway, without further ado, I will call on Dr. Folake Ogundele. So Career Talk on Psychiatry today. I welcome on the screen Dr. Folake Ogundele. I almost said Owolowofela. You're welcome. Thank you very much. So,
thank you. Welcome.
Would you like to introduce yourself, please?
Folake, I like my first name, Folake Ogundele. I'm a psychiatrist. I work in Abeokuta, the neuropsychiatric hospital, Abeokuta. I'm a mom. I'm a writer. A drama artist. I'm many things in one. I'm a wife. I'm many things in one. So I juggle all these things together.
Wow. And yeah, and by the way, she writes so well. She writes so well that when you read, you just want to keep reading and reading and reading more of her writings. She's very good. So you're the best person to talk to us today about psychiatry. So what is psychiatry about, and how is it relevant in the world today, especially in the season of COVID-19 pandemic?
Okay, so psychiatry is a field of medicine. It's a field under medicine that deals with diagnosis, treatment, prevention of mental disorders generally, mental disorders, emotional disorders, and psychological disorders. So if you have people who have challenges with mental well-being, in at-risk groups, that's what a psychiatry would do, help them with these challenges. So that's essentially what psychiatry is all about. It's a field of medicine. You have to be a medical doctor to go into psychiatry. There are other mental health professionals that we work with, but for psychiatry, you need to first have been into medicine. You will graduate as a doctor, and then you can now go for your residency. You go for your residency, that's postgraduate studies in psychiatry, and then you qualify after some sets of exams as a psychiatrist. So you can then work as a psychiatrist. So how is psychiatry relevant in the world today? How is psychiatry relevant in the world today? For a lot of countries, you would find out that so many things are happening in the world. Particularly in this COVID area. COVID was an unexpected happening. It was an uncharted territory. Nobody knew anything about it before it started. And then this is something that's associated with a lot of morbidity, mortality. And it's also affected the economy of most countries. A lot of countries are just bouncing back from the effect of COVID. So how is it relevant? Anywhere you have suffering, anywhere there's disability, anywhere you have stress, anywhere you have disasters, people react to it. People undergo stress. Anywhere there's stress, people, people have um, complications in terms of their mental well-being. And so psychiatry is an area today that is really, really relevant for people to for you to have a good society, a society that is productive, a society that is functional, for people to be able to cope with their day-to-day challenges, they need to be mentally well. And that's where psychiatry comes in. You find that there is increasing rates of mental disorders, increasing rates of suicide, increasing rates of drug and alcohol use, substance use disorders all over the world. And even when you talk about some non-communicable diseases, psychiatric disorders are in the front. Right now, psychiatry account for about 11% of the disability that comes from non-communicable diseases. So it's really, really relevant, particularly when you talk about depression. Depression by year 2030 is expected to account for people who suffer the most in terms of disability. So that is what we are saying, that psychiatry is really, really relevant in the world today. You cannot be well if your mental health is not well.
Thank you very much. You cannot be well until your mental health is well. And the way our brains are wired, it's such a very sensitive organ of the body. Just like the heart, the brain is very sensitive. And I'm not a medical doctor, but with so many things that are going on, it all starts from the brain. Even when you have a pain in your arm, is all the brain, giving you signals. So you are doing a wonderful job going into that field. If I may ask before the next question, why psychiatry? Why not maybe general practitioner or orthopedic or any of those? What steered you up into psychiatry? For those who are listening and thinking, oh, I actually want to do psychiatry, but maybe your story would help them to make a right choice.
For me, why psychiatry? I chose psychiatry because I think, one, I could relate with the field. I could relate with the patients. There's a lot of stigma associated with psychiatry.
Sure.
And when people see people that have challenges with their mental health, we tend to snicker, we tend to make fun of them, mock them. There's a lot of stereotypisms, there's a lot of labeling when you talk about psychiatry. But I see people with mental health challenges as normal. And I see myself, I see how they break down. It's not unusual. It can happen to anybody. Anybody can have mental health challenge. You are not special. Like I tell people, unless you're dead or you're not yet born, that's the only immunity you have against mental health. So I had this empathy. It was easy to empathize. It was easy to say, oh, if I have this challenge, I want somebody to be objective, and I want somebody who will pay attention and would really enjoy, helping me to get better. So I think that's one of the reasons why I chose psychiatry. And then as I like to also see it, psychiatrists are very objective people. We see the patients globally. All other fields of medicine, they attend to just their discipline, just that area that they are concerned about. You cannot see a psychiatrist and that person will not be concerned about even your physical health, your social life, your emotional well-being, your finances. We look at the patient holistically. So we see you, we get it, we understand, and we're objective. And that's why I like psychiatry.
A lot of compassion, empathy is needed for this field. Thank you very much. And I know you're very empathic. You're a very compassionate person, and I'm really blessed listening to you. And I'm sure there are people who are out there who are like, oh, I want my child, or my child wants to go into psychiatry. What advice do you have, and all of that? So it's nice that you're here talking about it. And meanwhile, viewers, if you're listening, you've got questions, just write them in the comment down below, because Dr. Folake is here to answer all of your questions. And next question, I know you've mentioned a part of it, but if you want to itemize, how do I know? How do the young people watching, how do the younger generation who are watching this now, or who have children who want to advise their children, how do they know if psychiatry is for them? Could you itemize? I know you've talked about being compassionate, having empathy. Are there other qualities you think people need to have to?
Well, for you to be a psychiatrist, first and foremost, you must go through medical school. That's the number one prerequisite. And then, do you enjoy, during medical school, you would have gone through the psychiatric posting. So during the psychiatric posting, how was it? Did you enjoy it? Could you understand it? Did you have empathy? Were you able to patients? Do you see yourself enjoying it? Is this something you can live with? Is it you? I think you just know. Now the problem is with maybe the parents or the significant people, because of this stigma treated with psychiatry, a lot of people that might want to do psychiatry, they end up dropping the discipline because the close people to them, they usually do not agree. So I would say that give the person a chance. At the end of the day, it's important for everybody to love what they do. So you must enjoy what you do. You must have that job satisfaction and feel that what you're doing has its own worth and you're contributing to society. So I would say that is really what matters. Do you enjoy it? And then you must be objective. Not every you will need to say, oh, this is a medical condition, not totally a functional illness, a psychiatric illness. There are times you will need to be objective, and if you do not agree that the person has any form of any major psychological challenge, you need to be able to state it. So you must be objective, see the patient holistically, and I think you must also enjoy talking. You cannot rush. You need to understand the person. You need to understand your clients. So it's not a field of medicine where you just rush. You see the patient and then you're gone. You must be able to enjoy spending time with patients. It's not just a quick diagnosis and then you understand what has been happening in the person's life for the past 30 years, for the past 60 years. You need to sit down and really, really understand. So if you are not that kind of a person that you like talking, you like sitting down for long and staying with people, then maybe that's not for you.
Thank you. So the main thing actually is that you need to go through medicine. You need to start off with wanting to be a doctor, a medical doctor. And from that, during postings, if it's psychiatry or it's pediatrics or whatever it is. Okay, yeah, that's so. The first, for people who are in secondary school who are thinking, I've not even done any. Some will say JAM, some will say GCSEs, some will say A levels. Different countries have different routes to getting into medical school. So for those who are in secondary school, who are choosing their subjects, what would you think are the subjects they need to start looking at?
Science courses, biology, physics, chemistry, and then in Nigeria, the prerequisite maths and English and mathematics.
Okay.
So
okay.
5
very important. Sciences are the backbone. They are the backbone of being a medical doctor, and from there you can now specialize into psychiatry and all of other fields of medicine. So thank you very much. I want to ask you I wouldn't ask you the next question because you've already mentioned when you were talking about having a work experience, it would help you to decide if you really want to go into psychiatry or not. So I want to ask you that again. But what steps can I take to be relevant internationally? Some people are like, oh, is the way they study psychiatry in let's say Nigeria or Ghana or South Africa is different from the way they do psychiatry in the UK or in other Western parts of the world or US or Canada. So what would anyone need to do to be relevant internationally? I'm not sure if I'm
Okay.
right. Psychiatry is different in other parts of the country. I'm just saying people might have that notion that, oh, is it different? Is it the same? If it's the same, what can I do to be relevant internationally?
I think what may be different are the processes of qualification
Oh,
as a psychiatrist, the exam process. But
mm,
once you qualify in your area, you may need to be accredited in another country. So,
mm,
but once you're a doctor program anywhere, if you're accepted, if that country has would accept foreign students. But in Nigeria, once you're qualified as a medical doctor, you go for your residency. Once you finish residency here, if you want to travel abroad, I know particularly to the UK, you need to pass your English test, and
mm,
then there are 2 or 3 stages of exams that you would do, and then you can practice in the UK. Essentially, psychiatry is the same. You
okay.
know, it's the same. We use the same diagnostic methods. Of course, there are differences in phenomenology between country to country. The way a black man would, an African or a Nigerian may present with features of psychosis, for example, may be a bit different in terms of cultural influences to how somebody in the UK. But at the end of the day, psychosis is psychosis. We use the same criteria to make our diagnosis. So it's still going to be the same. So if the country allows foreign practitioners to practice in their country, then they would take you to your country as being standard. The training in your country has been standard. But other things you could do to be relevant internationally, you need to be good in your place of practice. You need to be able to give your place of practice. If you are not good in Nigeria, you will not be good anywhere else. If you are not giving your best here, you will not give your best anywhere else. And wherever you're working, one of the things the world is looking at now is advocacy. Wherever you're working, in the rural area, in the urban centers, Western, African, Caribbean, wherever you are, advocacy for people with mental health challenges. We need to advocate. If you are into psychiatry, you must advocate. There's a lot of suffering, there's a lot of care burden that's wrong. And once someone is ill, the society is also ill. So advocacy, it's you. If you are advocating and mental well-being, then you will be relevant internationally. And then if you are able to go into research,
Mm,
and you are doing research, conducting research that are of global importance. Like now, I think COVID is one of the relevant issues globally. So if you are able to conduct research that are relevant to the needs of your environment and the global world, then you will be relevant internationally. If you're able to meet, there's what we call mental health gap. If you're able to help patients bridge that gap, whether through your advocacy, whether through research, whether through you're giving your best in your place of practice, then you're relevant internationally. And I think those are the things we need to focus on.
yeah, thank you. So writing papers and all the research, yeah, well done. Thank you very much. Thank you for this. So, what is your favorite famous quote or a Bible quote and why?
Favorite quote, I have many, and I think it depends on whatever I'm going through. That determines what my particular quote will be. But one thing, a quote that I really, really like, I try to use it as much as I can, is that one um, from Corinthians that says, "Praise be to our God, the God of all comfort, who comforts us in all our troubles, that we having received comfort may comfort others. That gives me a sense of hope. That tells me that whatever you're going through, no matter how difficult, no matter how hurtful, how painful, you can help others. And I think that's essentially what psychiatry is all about anyway. That is hope, that you can help others. It doesn't matter where the stage in which you are, whether the suffering is still much or not, you can still impact. We need to impact and help people. There must be a reason for whatever negative thing we are going through. So that gives me hope. I think I tend to use that a lot, especially in my field. I don't need to say it to patients. There are patients that are not Christians or may not appreciate you preaching. If quoting Bible passages, not preaching. My work as a psychiatrist is not exactly about preaching, but quoting Bible passages. But in my mind, when I'm working, that's what guides me, tells me, help this person can still help another person.
Thank you. Out of curiosity, I'm just wondering, has faith helped people in their mental stability, or has it actually, has it acted as a positive more, or is it more of a negative to people? I would like you to comment.
It's more of a positive. I'm a Christian. I'm also a doctor. And having faith, even when you see patients who are, who are resistant to treatment, it helps me keep hoping. You don't get discouraged easily. There's a lot of burden too when you talk about psychiatry amongst doctors. Doctors also have a lot of burden for patients, and sometimes there may be burnout. So having faith helps me, keeps me going. And then for patients too, talking about suicide, it's helped a lot of patients that I've seen to hold on from actually going the whole way. When they begin to have suicide thoughts and suicidal behaviors, that faith helps them not to complete. It gives them a restraint. So I've seen when you ask the patient, so have you tried to kill yourself, or have you done anything really dangerous to yourself? And then you hear them say no. I say, why? I say, because I know God will not like it, or I know that God can still help me. So it helps them a lot. It really, really helps them a lot around here. Another way that our religion, our health, is in terms of social interaction. Some of our patients, by reason of their illness, they withdraw to themselves. They lose their social skills. And when they do that, it's more difficult to rehabilitate them. It's more difficult for you to get them back to the society, to work, to marry, So what religion does is to give them an atmosphere, that is suitable for them to mix with other people. It's especially if it's not a toxic environment. If the community, that faith community, their understanding, they help the patient to reintegrate back into the society. Some actually get them treated and get them into the community. So it's really been more positive than negative. But sometimes, in terms of faith, in terms of religion, you really do have negative setbacks. Sometimes, a lot of times in this community, when the patient has mental health symptoms, particularly the severe type, they take them to faith houses. And sometimes really there's a lot of suffering. Some really bad, nasty practices go on in some of these places. So those are negative, and then sometimes patients will not comply with medication based on this faith, and they keep having repeated episodes. So those are some of the negative aspects. But in terms of the positive aspects, we do see a lot, and we work with people who give us positive results. We are open to accepting help from faith houses if we count it as positive, if they have a positive influence on the patient. But we are very guarded when it comes to letting them have input. We are very selective.
Thank you. Thank you very much. I'm sure there'll be people who are listening who have just joined us who will be thinking, oh, I have got a question. I've got a question. Can you answer this? At the moment, we can't take the question. I mean, we can't answer the questions, but please write in the comment down below, and Dr. Folake will be, answering all your questions when it's when this is made live. Selecting psychiatry as a career for the younger generation. Is there anything you want to encourage the younger generation about?
Psychiatry as a career, it's awesome. You can easily get that fulfillment. You can walk anywhere. There's psychiatry everywhere. You're not limited by time, by space, by even technology. Nothing limits you. At least 1 in every 5 individual would have mental health challenges. So they are all around us. And it's fulfilling. You can build lives. You can have beautiful impact into people's lives. And I would encourage anybody that is thinking about it to go all out for it. It's a wonderful field. I've never regretted being in psychiatry. Thank you very much.
Thank you. Thank you. Thank you very much. I really appreciate your coming on this platform to tell us about psychiatry and how it will benefit the next generation, and encouraging and inspiring them to choose psychiatry. Thank you very much, Dr. Folake Ogundele. I really appreciate you, and I'm sure our viewers really appreciate the time you spent with us. Thank you. I know you're very busy. You need to go back to stuff you need to get around at the moment, and it was nice getting that part of your time, sharing the part of your time with us. I pray that every time you work with patients, that they will get better, and the Lord will give you ideas, will give you, inspire you, this will give you discernment, will give you more gifts on how to treat patients and how to get into their heads, and even speaking words that will liberate them in the name of Jesus. He will empower you, will grant you the mantle, and you continue to be a light to those who need light in the name of Jesus. God will empower you more, and I pray that more of people here. So maybe when we have so many questions again on the platform about it, it will be nice to have you back to answer those questions. So thank you very much for your time. I really appreciate it. I love you so much. Thank you. Thank you. God bless you. Have a good day. Bye. Bye. So thank you very much, viewers. You have heard it all from the expert. So please type in the comment down below if you've got any questions bothering your mind and you want to know anything about mental health you want to know. Please do not hesitate. Write it down in the comment down below, and I will link you up with Dr. Folake, who will be able to answer all of your questions. Thank you for watching. You've been awesome coming here to listen. I wouldn't be doing this if it's not for your support, if it's not for you coming in to listen and being blessed. So enjoy your day and have a lovely, lovely, lovely day. God bless you, and I'll see you next time. Bye-bye.